If you've ever struggled with depression, you already know it doesn't just affect your mood. It can touch every single corner of your life. The energy to get out of bed, the motivation to work, the spark in relationships, even the ability to feel pleasure. And then, when you finally get the courage to seek treatment, there's this new challenge. The medications that can lift your mood, like SSRIs, sometimes come with side effects that impact your sexual function. And that can feel confusing, frustrating, and even discouraging. That's exactly why I wanted to make this video. Because this is real life, and it's a conversation too many people are scared to have. But today, we're having real talk about depression, SSRIs, and sexual health. Well, now before we go deeper, let me ask you, have you or someone you love ever faced the challenge of balancing antidepressant treatment with changes in sexual function? If you feel comfortable, I'd love for you to share your experience in the comments. Because trust me, you're not alone. Your voice may give courage to someone who feels like they're the only one going through this. Here's what I want to do in this video. I want to give you clarity. I want to break down what SSRIs are, how they help with depression, why they sometimes affect sexual health, and most importantly, what you can actually do about it. My goal is not just to inform you, but to empower you to take action, to have honest conversations with your healthcare provider, and to remember that your well-being matters in every dimension, including your intimacy and relationships. So let's start at the foundation. Depression is not simply feeling sad. It's a condition that can change the way your brain processes information, emotions, and even physical sensations. Many people describe it as a heavy fog, a lack of motivation, a loss of interest in things that once mattered. It can flatten joy and heighten guilt. It can make life feel harder than it should be. And it's not your fault. Depression is an illness, not a weakness. I want you to hear me on that. It is not a reflection of your value as a person. Now, SSRIs, selective serotonin, reuptake inhibitors, are some of the most commonly prescribed medications for depression. They work by increasing the availability of serotonin in the brain. Serotonin is one of the chemicals that helps regulate mood, emotion, and sleep. For many people, SSRIs can be life-changing. They can bring relief, energy, and a sense of stability back into life. That's why doctors often recommend them as a first-line treatment. But here's the part we need to talk about openly. SSRIs can also affect sexual function. This can include things like reduced desire, difficulty with arousal, or challenges reaching orgasm. Some people notice it mildly. Others experience it more strongly. And because sex is such a personal and vulnerable topic, many people never bring it up with their doctor. Instead, they silently carry frustration or guilt. And that silence can strain relationships, lower self-esteem, and even make people stop taking their medication altogether, which, of course, risks their mental health spiraling again. I want you to know this. If you're experiencing sexual side effects from SSRIs, you are not broken and you are not alone. This is a known common side effect, and importantly, there are ways to manage it. So let's break this down further. Why do SSRIs affect sexual function? Serotonin plays a role in mood, yes, but it also interacts with the pathways of dopamine and norepinephrine, chemicals linked to desire and reward. When serotonin levels are higher, it can sometimes dampen the signals that trigger sexual excitement or completion. In plain language, while SSRIs can help lift emotional heaviness, they may unintentionally dim the body's natural sexual responses. And because everyone's brain chemistry is different, the impact varies from person to person. Now, here's the hopeful part. Just because you experience this side effect doesn't mean you have to choose between mental health and sexual well-being. You can have both. It starts with awareness and honest communication. The first step is talking to your doctor. I know it can feel uncomfortable, but doctors hear this more than you might think. and a good doctor will treat your concerns with respect. Remember, you are not complaining. You are advocating for your quality of life. Be specific. You can say, "Since starting this medication, my mood is better, but I've noticed changes in my sexual desire," or "I'm having more difficulty reaching orgasm than before." The more open you are, the easier it is for your doctor to help you. Second, there are options your doctor can explore with you. Sometimes, adjusting the dose of your SSRI can reduce side effects while still maintaining its antidepressant effect. Other times, switching to a different SSRI or even a different class of antidepressants can make a big difference. Medications like bupropion, for example, work differently and may have less impact on sexual function. But these decisions must be made with your healthcare provider because every medication has its own benefits and risks. Third, there are strategies beyond medication adjustments. Timing can play a role. Some people notice that taking medication at a certain time of day makes side effects less noticeable. Lifestyle factors also matter. Regular exercise, better sleep, and stress management all support both mood and sexual health. And don't underestimate the power of open communication with your partner. Talking about what you're experiencing can relieve the pressure and help you both explore new ways of connecting. I also want to remind you, sexual function is not just about intercourse. Intimacy is broader. It includes touch, affection, shared laughter, and emotional closeness. Sometimes exploring these dimensions can reduce the frustration of side effects and strengthen a relationship while you and your doctor work out the medical side. Now, I know some of you might be wondering, do these side effects go away if you stop the medication? The answer is, often yes. Sexual function can return to baseline after discontinuation, but please, do not stop your medication suddenly or without medical guidance. Stopping SSRIs too quickly can cause withdrawal symptoms and risk relapse of depression. Always have a safe, guided plan with your doctor. Another question I often hear is, why don't doctors talk about this more openly from the beginning? And to be honest, it's partly because there's still stigma around mental health and sexual health. Sometimes there's not enough time in appointments, or doctors assume patients will bring it up if it's a problem. But I believe this conversation needs to be part of the standard dialogue. That's one reason I'm making this video, to empower you to ask, even if your doctor doesn't. Continued below, I also want to acknowledge the emotional side of this. When depression already makes you feel disconnected or unworthy, adding sexual side effects can amplify those feelings. You might start questioning your desirability, your relationships, or even your identity. Please remember, this is not a reflection of who you are. You are not less than. You are a whole, valuable person who deserves health, happiness, and fulfilling relationships. The fact that you're watching this shows you're taking steps toward understanding and growth. And that is powerful. So, what can you actually do starting today? First, reflect honestly on your experience. Are you noticing changes since starting or adjusting your medication? Write them down. Be clear about when they happen, how intense they are, and how they affect you. This helps your doctor understand the full picture. Second, prepare yourself mentally to have that conversation. It's okay to feel nervous, but remember, you are the expert of your own body and experiences. Third, keep perspective. Sexual side effects are real, but they are not a dead end. Solutions exist. Sometimes it takes patience and trial and error, but progress is possible. And here's another encouragement. Depression treatment is not one size fits all. Some people respond best to therapy, some to medication, some to a combination. Sexual side effects are one piece of the puzzle, not the whole story. By staying engaged in your care, you are actively shaping your own recovery journey. That's something to be proud of. I also want to emphasize the importance of self-compassion. It's easy to get frustrated, to blame yourself, or to feel hopeless. But what if you approach this with the same kindness you would offer a friend? You'd tell them, "This isn't your fault. You're doing your best." You deserve support, so give yourself that same message. Sometimes, shifting the way you talk to yourself can ease the weight of the struggle. Now let's imagine this together. Imagine you have the courage to tell your doctor exactly what's going on. Imagine you explore options, maybe try an adjustment, maybe switch medications, maybe add therapy or lifestyle changes. Imagine slowly noticing improvements, not just in mood, but in energy, intimacy, connection. That's possible. That's what I want you to hold on to, possibility. Because too often, people accept suffering in silence. And silence is the enemy of healing. So let me be very clear. If you're on an SSRI and experiencing sexual side effects, don't stay silent. Speak up. You are not alone. Millions of people face this, and millions have found solutions. You can too. Before I wrap up, let's go back to that question I asked earlier. Have you or someone you know faced this challenge? If you feel comfortable, drop a comment below. Your story might be exactly what someone else needs to hear to take the next step. And if you're not ready to share publicly, that's okay too. Just know you are part of a community here, a community that understands, supports, and wants you to thrive. I'll leave you with this. Depression is treatable, sexual health matters, and you do not have to choose between the two. You deserve both. You deserve joy in your mind, strength in your body, and closeness in your relationships. Don't let fear or embarrassment hold you back from seeking the balance you need. Start the conversation, stay engaged, and remember, you are worthy of full, thriving health. Thank you for spending this time with me. If you found this helpful, let me know in the comments and consider sharing this with someone who might need it. Together, we can make these conversations normal, open, and empowering. You've got this, and you're not alone.